Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location at Columbia Fertility Associates in Bethesda, Maryland, discussing the latest advancements in infertility treatment that can help couples have the child that you've always wanted with one of this area's top fertility specialists, Dr. Rafat Abbasi. Dr. Abbasi received her medical degree from the University of Sindh in Pakistan and completed her residency from St. Joseph's Hospital in Towson, Maryland. She received her fellowship training from both Georgetown University Hospital and the National Institutes of Health in Bethesda, Maryland. Dr. Abbasi is board certified in reproductive endocrinology and infertility. Welcome, Dr. Abbasi.
Thank you. It's great to be here.
Oh, it's our pleasure to have you on. First time, in fact, on A New Me. We've got a lot to talk about, so let me just begin, if I may, by asking you, I guess for background purposes, so we have a better understanding of what we're looking at, if you could please tell us just how many folks out there are unable to have a child. What are we looking at?
Well, infertility is a very common problem. It's increasing. And at this point in time, there are about 1 in 5 couples who deal with this issue, as many as 20% of the population.
That is significant.
That's
My
correct.
goodness.
That's right.
And what are some of the common causes of infertility?
The most common cause in this area probably is delayed childbearing, where women have put their careers first, their education first, and so they've delayed childbearing to the point that it's becoming an issue. Most patients that we see are in their late 30s or early 40s. So that becomes a significant problem. The other leading cause of infertility may be tubal disease, where the tubes are blocked, or even male factor, where we have problems with sperm counts and semen abnormalities.
And especially in this region, based on what you just said a few moments ago, Dr. Abbasi, with so many working couples, obviously husband and wife, like you just said, most people are pushing it off a bit further, and hence they start taking the chance of not being able to have a child.
That's right. And by the time they decide they want to have a child, no one even imagines how difficult it can become.
That brings me to today's topic. If you can please tell us, Dr. Abbasi, what are these latest advancements in infertility that we're here to talk about today and educate the viewers?
The most important advance in the last several years has been the advent of in vitro fertilization. With in vitro fertilization, we're now able to take eggs from the female partner, inseminate them with sperm from the male partner, and allow the embryos to be grown in the incubator before we transfer the embryos to the uterus. That's the basic premise of in vitro fertilization. Obviously, since then, many more advances have occurred. The advances that we deal with now include genetic testing of the embryos before we transfer them, so diseases like Tay-Sachs and hemophilia can be diagnosed. We can today freeze eggs, which was not something that was done before, and freezing eggs fits in with delayed childbearing, because a woman can freeze her eggs in her mid-30s or early 30s and then not be able to get pregnant till 40 or 42 if she so desires. Previously, sperm were frozen very commonly and often, but eggs were difficult to freeze. We now can freeze eggs, so that has been a significant advance in the field of infertility.
That is very interesting indeed. So that does allow for those women out there that want to push it off a bit further because of their careers to actually freeze the eggs, as you just said, at a younger age and then come back a few years later.
That's correct. We also do egg freezing for patients who may have breast cancer and other cancers, because that is in itself a reason to freeze eggs, get treated for their cancers, and then come back to allow childbearing to occur.
Now, I wanted to ask you, Dr. Abbasi, how are these procedures or treatment options performed, just so we have an understanding of what we're looking at?
The female patients have to go through induction of ovulation, which is by injections of medications, hormonal medications. We then retrieve the eggs from the patient by sonograms, transfer the eggs to the incubator, or freeze them.
And what would you say is the success rate of these treatment options?
Well, the success rate depends on the woman's age primarily and what the reasons for the infertility are. Delayed childbearing means decreased pregnancy rates, no matter how you look at it. The younger the couple, the younger the female partner, the higher the probability of getting pregnant. So below the age of 35, for example, for a female, the pregnancy rate may be as high as 50%, which is significantly high. The natural pregnancy rate, by the way, is only 18 to 24% per cycle. Okay. So in vitro fertilization really enhances the probabilities of pregnancy, especially in a younger patient.
Yes, it does. Basically doubles it.
Absolutely.
Not more.
Mm-hmm.
Now, are there infertility treatment options that are available for both women and men?
That treatment would be in vitro fertilization.
Okay.
Because with sperm problems, for example, you can isolate a single sperm now and place it directly inside the egg with in vitro fertilization.
And how long does it typically take for a successful pregnancy to occur? I know it varies, I'm sure.
The entire cycle will take about 4 weeks to do. Okay. Once they're pregnant, then of course the same parameters hold true as if they were pregnant naturally.
We're now going to meet a patient of Dr. Abbasi. Welcome, Merav and Margot.
Glad to be here.
It's our pleasure to have you both on with us today on our program. And I wanted to begin by asking you, Merav, prior to coming to Dr. Abbasi, were you trying to get pregnant previously and had no success, and then you came to Dr. Abbasi, or what was the scenario? What happened? How did that play out?
We wanted to get pregnant. We wanted to have a family, and we heard amazing things about Dr. Abbasi, so we went to her to help us have a family.
All right, and what did she recommend, and what did you have done?
So she recommended, also because of my age, I was 38 at that time, not waiting too long, so being a little bit more aggressive on the treatment. And so we started with some drugs to increase my production of eggs, and we were very successful very fast with her, so we're very happy.
So, and how long after you went to Dr. Abbasi did you become pregnant?
I think was between 5 and 6 months.
And were there any other visits that you had with Dr. Abbasi since then?
Yes, and she became a kind of a close friend of the family. She's the godmother of our son.
Oh, that's wonderful. And let me ask you, Margot, how does it feel?
Well, it feels great. I mean, you know, the idea of having a kid, I think for us was a fantasy, an idea that we didn't think was going to be possible. And the day that Dr. Abbasi told us that she was pregnant, I don't think I believed it. I think I was kind of like, oh, well, maybe. I'm not really sure if that's possible. I mean, it seemed kind of crazy how one day she's not pregnant, one day she is pregnant. But it was an amazing experience. And the day that, you know, we saw, a heartbeat on the monitor was just, I can't tell you what an amazing experience that was for us.
Do you all have a boy or a girl?
We have a little boy. He's 17 months old.
And Abbasi kind of became, the family, extended family of him. So
Can I tell you all something? That is the greatest blessing that God can give.
It is. And in fact, when he was about 2 or 3 months old when we brought him to see her in her office, and he looked at her and he said, "You look familiar to me. I'm not sure why, but you look a little familiar." He did give her a look that he knew he had met her before. It was very funny.
It was very cute.
Well, I'm so happy to hear that, and I take it you both are obviously very pleased with Dr. Abbasi. She's the godparent, for God's sake.
Exactly.
Of your son. So.
She has birthday, so she dropped presents.
Oh, that's wonderful. And for all the viewers out there that are watching, and the folks, the women who tried to become pregnant but have been unable to thus far, I take it you both strongly recommend Dr. Abbasi.
Yeah.
We do. And I think one thing that I'd say about Dr. Abbasi is that I think she's extremely pragmatic and realistic, and she's also incredibly, gave us a lot of hope, and I think all those things were very helpful for us in the process.
Well, I'm so happy to hear that. And on that note, I'd like to thank you, Merav, and you as well, Margot, and congratulations on your new son.
Thanks.
We're now back with Dr. Abbasi. I must say she was very pleased. You basically changed her life. You gave her the great joy of being able to have a child, and certainly both of them seem very happy.
Yes, thank you. They are happy, and this is what we aim for, is to be able for our patients to have families.
What would you say, Dr. Abbasi, is the recommended age range for women who are seeking to become pregnant?
Well, there's no question that the younger the female, the higher the probability of success. Most patients don't see us, though, either for their personal reasons or because they've been with their obstetricians for a long time. before the age of 37, 38. Ideally, if the patient is between 30 and 35 is the best time for her to see us.
Yes. I understand that your organization, Columbia Fertility Associates, has successfully achieved very high pregnancy rates, Dr. Abbasi, and I wanted to ask you if you can tell us two things, basically. One is, how did you all achieve such high success rates regarding pregnancy, as well as what sets you and your practice, Columbia Fertility Associates, apart from the others in this region, because you have a very good reputation in this field.
Well, thank you. Columbia Fertility Associates was part of Columbia Hospital for Women, which is a very old hospital in DC.
Yes.
It has now closed, however. But Columbia was one of the first IVF programs in this area and had the first baby from in vitro fertilization back in the 80s. Since then, advances have led to more advanced care and state-of-the-art technologies available. We have all the cutting-edge technologies. We haven't stayed in the 1980s. We've moved forward and kept up with the technology changes. My partners and I have been working at this for a long time, and we have an excellent lab with all the technical equipment and excellent embryologists available. Our office is very unique in that we deal with our patients solely as if we were solo practitioners, because we have individual physicians and individual patients, and we take care of our own patients. Our offices, the support staff in our offices is very friendly and very caring.
Well, our research has certainly backed that up, Dr. Abbasi. You have a very good reputation. You all really care for your patients, if I may use that phrase in the medical field these days, but it's so true with your practice, and your staff gives a lot of personal attention, as well as you and the other practitioners here. Are these treatment options that you've discussed here today, Dr. Abbasi, covered by insurance?
Well, that's really a loaded question, because our practice is a tri-state practice: Washington, Virginia, DC, Virginia, and Maryland. Maryland is what we call a mandated infertility coverage state. So yes, in Maryland, most insurance companies do cover infertility treatment. Virginia is different, because Virginia is not a mandated state. So some insurance carriers cover it, some don't, and DC is the same way. The federal government, which is one of the big employers in DC, does have infertility coverage. So it depends more on where the patient's employment is and where the insurance is.
We've only got a few moments left. I have to ask you if you have any final thoughts that you'd like to share with our viewers.
It's important for the viewers to understand that not all the patients that present to an infertility practice necessarily end up doing in vitro fertilization. At least 15% of that 20% population can get by with less aggressive modalities of treatment. There's drugs for ovulation induction, there's inseminations of sperm into the uterus. There are many less technically aggressive procedures available. I think the second important point that people should realize is that age is the most important determinant of fertility success. The younger the patient, the higher the probability. So I would end by saying that it's most important for women today to realize that they can have all the options and choices that they want. They can have delayed childbearing. They can pursue education and career and professional opportunities, as long as they're thinking ahead and do things like planning to freeze their eggs for the future.
Well, Dr. Abbasi, I want to thank you. This was a very informative and very insightful interview indeed, and I'm sure very helpful to a lot of folks out there that are watching. And on that note, I'd like to thank you again for joining us and being a guest on A New Me.
It's been my pleasure. Thank you.